Hey there. Are you feeling a little sluggish, a little grumpy? Maybe you're not as interested in sex as you used to be, or worse, maybe you've lost your interest altogether. Well, my name is Dr. John Heary, and today we're going to be talking about testosterone. We're going to be talking about, what it is, how it works, what it does, and before you assume anything, maybe it might be a good idea to take a look at your testosterone levels. If all the above hits home, the chances are good that that they're dropping, and that's not something that just affects elderly men. As a matter of fact, testosterone levels they start to drop and they start declining when we reach our late 20s, and by the time we hit our golden years, they can be dangerously low. But don't worry, there's plenty of ways that you can boost to maintain those levels. So you can enjoy your innate masculinity, stay cognitively stay sharp, and also maintain muscle tone and muscle strength. So, what you're gonna learn today is what testosterone is, how it works, how it functions, what happens when it does become low, how you can boost it naturally, and when should you resort possibly to testosterone replacement therapy. So we've got a lot to go over. I'm going to break it down into a couple different parts. But let's start with the basics. So what is testosterone? Testosterone is it's an essential hormone that it serves various functions in both men and also in women. Obviously, in men, it's going to be in higher concentrations, which is why it's referred to as the male hormone. Testosterone is produced primarily by the testicles in men, while in females, the ovaries and the adrenal glands play on that part. So let's talk about the functions of testosterone. It's the main androgenic hormone, or in other words, it's the main hormone for growth and reproduction. It's involved in the development of the male genitalia and also secondary sexual characteristics. It does have an anabolic effect in both sexes, and it has been shown to affect behavior too. Now, the main functions of testosterone include libido regulation, right? Development of male traits. It does play a part in bone mass, fat distribution, strength development, muscle mass, um, also in red blood cell production, and sperm production as well too. Now, if you do have low testosterone, there are certain symptoms that you want to look for. Um, Now, hypogonadism or andropause, that's something that naturally occurs as we age. Without a doubt, the best way to determine if you have suboptimal levels of testosterone is to make sure that you get a blood test done. But nevertheless, there are certain symptoms that can make low testosterone quite obvious, and some of those symptoms include erectile dysfunction, weight gain, losing your sex drive, losing muscle mass, depression, might not feel the same that you used to, decreased cognitive function. So, if you're struggling with those types of symptoms, it might be a good idea to get tested for low testosterone levels. That way you can find out for sure if you do have them. Now, because it's normal hormone in both genders, it's produced in different amounts by the body. The normal healthy levels of testosterone are going to be different. Now, in men, a baseline, for testosterone, it's around 300 to 1200 nanograms per deciliter, and that's for total testosterone levels. In females, it's 8.5 to 25 for free testosterone. And those numbers, they go from 15 to 70 for total testosterone. Now, the closer you are to the upper range, the better it is for you. If, however, you've been diagnosed with low testosterone, it's likely due to a variety of factors. Some of them include, you got to look at your lifestyle. You have to look at your eating habits, activity levels. Have to look at toxic habits, sleeping patterns, and stress management as well. Now, in the next video, I'm gonna go over some of the most important things that one can do to naturally boost their testosterone levels back to a normal, healthy baseline. So make sure that you do stay tuned for part two. Until then, stay healthy and look forward to talking to you guys soon.